Hello, I'm Jasper Palov, an undergraduate student in neuroscience at UBC, and this is a passion project of mine, which I have styled as a video essay called Selling Sanity. This project combines many of my most keen interests, neurodysfunction, pharmacology, video essays, which I watch an unhealthy amount of on YouTube, as well as art and 20th century history. Follow along with me as I deep dive into the dark history of the pharmaceutical takeover of psychiatry and its profound effects, largely through the lens of how these flashy new drugs were marketed. The psychiatric industry has long been under scrutiny for questionable practices in conjunction with drug companies, and no time was more evident of this malpractice than in the mid-20th century, when psychiatric drugs completely took over the scene, forever changing the world of mental health management and transparency. At the forefront of this revolution was a huge push for visibility for these pharmaceutical companies and their flashy new psychiatric drugs. This was done by staging a powerful and attractive public image, done through medical advertisements, ghostwritten articles, celebrity endorsements, and even funny research. Also that drug companies could boost massive profits while Western society could promote a culture of obedience and complacency, especially for its populations of so-called undesirables, those afflicted by these psychiatric conditions. These psychiatric drugs were massively overprescribed during a period of roughly the 1950s to 1990s, and perhaps the biggest contributing factor to this was through their widespread visibility and mass market appeal, basically a new cultural phenomenon. Benzodiazepines like Valium, which was the best-selling prescription drug of all time in 1978, with over 2.2 billion pills sold in just this 1 year, suggest widespread overprescription and medical negligence, with serious consequences. This video essay will focus on the corrupt and detrimental alliance between psychiatric institutions and pharmaceutical corporations in the mid-20th century, and how through wildly successful marketing campaigns they've managed to profoundly reshape the culture around mental health around the Western world. As a side note, I'm not an advocate against the psychiatric drug industry at all. I see enormous benefit in being able to safely medicate those who are in need of assistance, those afflicted by often life-derailing conditions. I am thankful that for people like my mother, who lives with bipolar type 2, she's able to access medications that genuinely improve her quality of life. This video is about when that trust the public has in psychiatric and pharmaceutical industries is broken, and when these seemingly good intentions of treatment and symptom management turn into genuine harm towards massive populations of often desperate people. Chapter 1, The Scene. In the decade following World War II, Western society was attempting to rebuild itself after devastation. Millions of men had returned from combat physically and psychologically scarred, while millions of others never returned at all, leaving broken families behind. This demographic shock, as described by Dan Book of Cambridge Population Research, laid the foundation for what would be known as the baby boom, but it also produced a quieter crisis, the widespread psychological strain among women who suddenly carry the burdens of child-rearing, domestic responsibility, and emotional caretaking, often without the stable presence of their partners, these men who the government were dependent on for accelerating the economy post-war. Newspapers and physicians of the era commonly referred to housewives' anxiety, a mix of loneliness, exhaustion, and emotional distress that had no formal diagnostic category, but generated a growing demand for tranquilizing remedies, any sort of escape from the monotony, the madness, the isolation. At the same time, psychiatric care still revolved around large-scale institutionalization. Mental hospitals were overcrowded, underfunded, and operated under a near prison-like model. The goal was containment, not treatment, as described by Michael Foucault in Madness and Civilization. Modern psychopharmacology had not yet emerged, and before the 1950s, physicians relied heavily on chemical sedatives for mental illness, most commonly opium and its derivatives. These substances were administered for everything from mania and agitation to insomnia, melancholia, which is an old-timey expression for depression, and severe anxiety, not because they targeted the underlying neurobiology of mental illness, but simply because they subdued abnormal behavior. By the 1910s to the 1930s, however, widespread dependence, escalating tolerance, and growing public concern over addiction pushed Western government regulators to restrict opium harshly, rendering it increasingly unacceptable as a psychiatric tool by the mid-20th century. This left psychiatry in a state of crisis just as demand for mental health solutions was rising in these distressed societies. Then, in 1954, Thorazine in the United States, and previously marketed in France as Largactil, entered the scene. Its FDA approval for psychiatric use marked a huge shift in the treatment of mental illness. Thorazine was hailed as a miracle drug, the first true antipsychotic, capable of calming psychosis in ways that were both more effective and less socially destructive than earlier sedatives and treatment strategies. Its introduction coincided with the massive deinstitutionalization movement, allowing thousands of long-term psychiatric patients to leave hospitals that once housed them indefinitely, helping to return them from social isolation, from complete societal ignorance. For the first time, psychiatry appeared to possess a pharmacological tool that could alter the course of mental disorder treatments. Yet this transition away from institutionalization and towards outpatient medication-based management also created the perfect environment for the next pharmaceutical revolution. As physicians grew increasingly comfortable and often negligent with prescribing chemical solutions, and as the public became primed to believe that emotional suffering could be medicated, the stage was set for the rapid rise of psychiatric drugs. Chapter 2: Bad Medicine. Early examples of misleading drug marketing reveal a pattern of aggressive promotion, concealed risks, and the medicalization of everyday problems long before the psychopharmacology boom of the mid-20th century. The Historical Medical Library at the College of Physicians of Philadelphia hosts exhibits where they walk through historical malpractice of pharmaceutical companies pushing so-called bad medicine as psychiatric treatments. In the 1890s, the Anti-Camnia Chemical Company pioneered mass pharmaceutical advertising through brightly colored mailers and collectible calendars featuring its iconic skeleton mascot, seen here, distributing promotional materials not only to physicians but also to everyday mothers, lawyers, and businessmen. This is hailed as the earliest form of modern psychiatric drug marketing. Despite being advertised as a harmless coal tar derivative, Anti-Camnia tablets were composed largely of acetylenide, an illegal, toxic, and habit-forming compound, and often mixed with codeine or even heroin to potentiate strong physiological effects. The 1906 Pure Food and Drug Act of the USA ultimately exposed the company's concealed ingredients and forced its collapse. A generation later, benzodrine, an early amphetamine, was marketed as a remedy for lethargy, behavioral disorders in unruly children, and fatigue in soldiers during World War II and Vietnam. Even as its over-the-counter inhaler form became widely abused, beckoning a dangerous pattern that persists to this day. They were cheerfully called bennies by a society that was happy to have a catch-all treatment for a wide range of psychiatric issues. Rising concerns over misuse led the FDA to ban these inhalers in 1965 and classified benzodrine as a Schedule II controlled substance in 1971. Similarly, when Thorazine gained FDA approval in 1954 as the first major antipsychotic, manufacturers promoted it to physicians across virtually every specialty as a magic bullet for any signs of nervousness, anxiety, or agitation, expanding its use far beyond its initial intended treatment of severe psychosis. This broad and often negligent marketing contributed to dependency, neurological side effects, and the normalization of medicating routine emotional distress, illustrating how early pharmaceutical advertising blurred the line between therapeutic innovation and commercial exploitation. Chapter 3: The Fashionable Treatment. Smith, Kline & French was a pharmaceutical company that pioneered the early model of aggressive marketing towards psychiatrists, deliberately positioning its drugs as solutions for a widening range of newly codified mental disorders and actively cultivating prescribing habits within clinics and state hospitals. The Historical Medical Library at Philadelphia explains how companies like Smith, Kline & French deployed hand-picked salespeople as detailers, essentially marketing assault troops. These details were not just ordinary salespeople, but highly focused and strategic in promoting their company's flashy new psychiatric drugs. Their job was to visit psychiatric hospitals and institutions and persuade doctors, administrators, or purchasing departments to buy and prescribe their company's medications. Essentially, these salespeople acted as the front line of the company's marketing strategy, building relationships, providing drug samples, influencing prescribing habits, and securing contracts. When Thorazine hit the U.S. market, SKF assigned a dedicated sales force whose job was to aggressively promote this antipsychotic drug to psychiatrists, hospital administrators, and the public hospital systems. Maximize prescriptions for treatment of these mental disorders and therefore maximize profits. They targeted large institutional markets, like state mental hospitals, not just private clinicians. Recognizing that hundreds of thousands of people were institutionalized, SKF capitalized on this and gave early, free, or low-cost samples to state hospitals to demonstrate Thorazine's effects on even the most hopeless or agitated patients. As can be seen in these ads, SKF reframed Thorazine as a magic bullet for a wide spectrum of mental health and behavioral problems, not just severe psychosis. Marketing materials like ghostwritten news articles and early advertisements described it as useful not only for schizophrenia or mania, but for anxiety, tension, agitation, confusion, hostility, and other nervous conditions. notably since direct-to-consumer pharmaceutical advertising was not legal until decades later. These ads never had to include side effect disclosures or consumer warnings because they were aimed at medical professionals, not the public. The companies got devilishly good at selling their drugs to the psychiatrists whose job it was to prescribe them. This is a crucial issue because this bred a culture of negligence where doctors without a proper understanding of the broad, often lasting effects of these drugs were prescribing them at high rates to patients who trusted their judgment. In the 1940s and 1950s, Smith, Kline, and French actively expanded markets for its drugs by promoting expert opinions and recruiting academics to influence prescribing practices. The company sponsored research, ghostwrote articles, and suppressed inconvenient findings to present Thorazine as broadly effective for psychosomatic problems or anhedonia, a practice now recognized as early disease mongering. These strategies reflect an early systematic effort by SKF to shape both medical opinion and clinical practice in ways that maximize prescriptions and profits, a strategy that was adopted by numerous companies to follow. These early pharmaceutical companies sold cost-effectiveness and institutional savings to governments and hospital systems. Part of their pitch was that Thorazine could reduce the costs of long-term institutional care, fewer patients locked in locked wards, and lower staffing needs, which appealed heavily to policymakers and administrators. They influenced public perception and medical culture through success stories. After early dramatic cases in France and elsewhere of Thorazine's amazing effects, SKF publicized results widely, helping shift psychiatry away from the lobotomy, the electroshock, and institutional care, and other old-timey treatments, and towards pharmaceutical interventions. This was the new way. This made psychiatrists more willing to prescribe, especially in institutional settings where prior options were limited and many mentally ill patients were frankly seen as lost causes. These early psychiatric pharmaceutical detailers targeted psychiatrists at a time when doctors had little independent pharmacological information. They knew little about the effects of these drugs and fell victim to the aggressive and enticing marketing tactics of companies like SKF. The drug advertisements published in medical journals, psychiatric newsletters, general practitioner magazines, presented at medical conferences, and directly via detailers, reframed ordinary negative emotions as medically treatable and expanded the customer base dramatically. Now, psychiatrists were being encouraged to discuss these drugs with large proportions of their patients due to the apparent broad effectiveness of symptom treatment and the excellent outcomes. The marketing of these drugs fit mid-century ideals of productivity, domestic harmony, and scientific progress. They use powerful visual storytelling, lots of before and after contrasts, showing patients recovering from severe mental distress. As can be seen, a lot of these marketing strategies were adopted by pharmaceutical companies to follow. Campaigns appealed to the physician's desire to help their distressed patients, shaping prescribing habits through emotional persuasion. Thorazine started to fall out of popularity as safer, more effective antipsychotics and other psychiatric drugs emerged, largely because its limited therapeutic range was overshadowed by its high burden of side effects, in particular its frequent and sometimes irreversible movement disorders, such as Parkinson's-like motor effects, dystonia, which is the appearance of sudden painful contractions, made clinicians shift away toward newer medications with fewer and less severe risks. By the early 1960s, the dangers of earlier drugs, from toxical remedies to addictive stimulants and heavy antipsychotics, it had become difficult to ignore. Physicians and patients alike were now looking for treatments that seemed safer, milder, and more compatible with everyday life. Pharmaceutical companies capitalized on this shift, presenting a new class of medications as modern, clean, and virtually risk-free. Into this landscape arrived the sedatives such as carbamates like Miltown and benzodiazepines like Valium, marketed not for severe psychiatric illness, but for the ordinary stresses of modern living, for convenient management of mental distress. Librium, Valium, Miltown, and the like were promoted as the safe tranquilizers, suitable for lonely housewives, exhausted workers, traumatized veterans, restless children, the senile elderly, and everyone in between, setting the stage for one of the most widespread and socially normalized drug booms in history. Chapter 4: The Sedative Epidemic. The focus on marketing of these sedatives was towards modeling obedience in wild children and restless wives, men struggling at work, returning soldiers with PTSD, senile elderly, etc., etc. Anyone who had a pulse and was dealing with a little bit of stress, yeah, they could benefit from a sedative and its strong calming effects. One of the kings of the sedative craze was Miltown. Released in 1955, it was first introduced by Carter Products and rapidly became America's first blockbuster psychotropic drug, meaning it affects a person's mental state. Miltown gained significant popularity in Hollywood. The drug was launched with a large marketing campaign in May 1955, and while initial sales were slow, Hollywood's embrace of the drug made it a cultural phenomenon by the end of the year. Milltown started to appear in popular culture, celebrity talk shows, comedy specials. Sedatives like Milltown benefited massively from celebrity endorsements. Milton Berle, a huge television star at the time, became so associated with the drug that he publicly joked about changing his name to Milltown Berle. He even made jokes about it on his hit show, including telling Elvis Presley, "You didn't want a girl, you wanted a Milltown." Other stars, such as Ginger Rogers and Jose Ferrer, were part of the Hollywood social scene where the drug was openly discussed and even passed around commonly at parties. Columnists of the era reportedly focused on the Milltown mania, quoting celebrities and their spouses on how the drug eased anxiety without completely knocking them out like older barbiturates, which behaved like stronger tranquilizers. The celebrity buzz provided substantial free publicity, which was particularly impactful because, as stated before, direct-to-consumer advertising for prescription drugs was illegal at the time. This word-of-mouth phenomenon helped turn Milltown into a bestseller. By late 1956, it was estimated that 1 in 20 Americans had tried the drug, making it a fashionable part of 1950s life. This Milltown craze was followed by Valium, the epitome of everything wrong with this pharmaceutical-psychiatric alliance. Valium gained cultural icon status, famously referenced in the 1966 Rolling Stones song, "Mother's Little Helper," which highlighted its use by the stressed and unfulfilled housewives. It was often marketed with the claim of having few side effects, making it a popular cure for nervy women. Those who were a little too wild didn't fit the mold of the obedient, adoring, subservient housewife stereotype of the time. Saying Valium was popular is a horrific understatement. It was booming. By the 1970s, it had become the most prescribed drug in not only America, but also Canada alike, a chemical quieting agent for an entire generation. Less a treatment than a cultural mandate to sedate women back into compliance. Sedatives had beaten out everything: antibiotics, blood pressure medications, and painkillers. It was top dog. Valium didn't just treat anxiety, it institutionalized it, turning everyday dissatisfaction with one's life into a diagnosable condition, and cementing Big Pharma's power to define what counted as a functioning ideal citizen. Chapter 5, The Glamour and Glitz. So what about the marketing of these drugs was so enticing to psychiatrists? The marketing of psychiatric drugs was highly effective because it combined modern, visually appealing design with reassuring messages of safety and progress, offering an attractive alternative to the harsh, outdated treatments of the past, like lobotomies and electroshock therapy. Advertisements used serene, artistic imagery and powerful before and after storytelling to validate patients' personal struggles, especially women's, without challenging existing social norms. They actively fed into these desirable cultural stereotypes, like the complacent housewife, the corporate workhouse husband, the respectful school children, among others. By aligning these drugs with mid-century ideals of productivity, domestic harmony, and smooth, exciting scientific advancement, the campaigns made taking medication feel not only therapeutic, but culturally desirable, turning pharmacological solutions into a symbol of modernity and social approval. These drugs, aligned with rising consumerism, and tranquilizers became consumer goods as much as medications. Even though the public didn't read JAMA or the Journal of Clinical Psychiatry, these images looked like consumer ads because they were highly stylized, colorful, and emotionally charged. They were designed to influence doctor behavior, not patient behavior. Because of the immense institutional power that doctors possess, this was the perfect business model. Sell the drug, the easy treatment, to the doctor, and he will in turn sell to the patient. The patient gets relief, maybe even progress towards getting their own life back, and the doctor gets the satisfaction of treating somebody that's in need. Chapter 6, The Snowball. The use of benzodiazepines like Valium quickly snowballed out of control across North America, fueled by savvy and aggressive pharmaceutical marketing, company-sponsored research, and widespread medical overprescriptions. While these drugs were initially celebrated for their calming effects, the dark side soon became clear. They were highly addictive, with long-term use leading to dependence and severe withdrawal symptoms such as anxiety, irritability, seizures, and even delirium. Users also faced cognitive impairments, including memory problems, poor attention, difficulty concentrating, while sedation, drowsiness, and muscle weakness increased the risks of accidents, particularly among the elderly. Despite these dangers, Valium and other sedatives were being prescribed at alarming rates, turning what began as a solution for everyday stress into a public health problem of widespread misuse and hidden harm, a ripple effect that became a hidden epidemic across the USA and Canada, and worldwide. Chapter 7, The Money and the Deception. For decades, major drug companies used aggressive marketing, financial incentives, and the manipulation of science to turn psychiatric drugs into blockbuster commodities, often at the expense of public safety and medical integrity. Marcia Angel, in her 2009 piece, Drug Companies and the Doctors, A Story of Corruption, exposed how companies like GlaxoSmithKline, GSK, were accused of burying negative data and knowingly misrepresenting clinical trial outcomes for drugs like their popular 1990s antidepressant Paxil. Internal company documents revealed that early trials showing Paxil were no better than a placebo and carried serious effects, including increased suicidality in adolescents. Rather than disclose these findings, GSK allegedly suppressed them and promoted a narrative of safety and effectiveness to massive commercial success. Similarly, there is substantial evidence of institutional corruption arising from ties between drug firms and researchers or guideline setters. A 2013 academic analysis by Lisa Cosgrove argued that commercial interests have distorted diagnostic criteria and clinical guidelines in psychiatry, compromising the research evidence and undermining informed consent. In addition, in many clinical trials and reviews of psychiatric drugs, company employees or financially linked quote-unquote key psychiatrists served as authors, and favorable results were emphasized and published hastily, while risks associated with the drugs or null findings were downplayed or ignored. Moreover, the role of kickbacks and financial incentives to doctors and institutions has long been documented as well. A 2002 investigative piece by Dr. Sidney M. Wolfe, called Big Pharma Buys Psychiatry, explains how pharmaceutical firms reportedly spent thousands of dollars per physician annually to influence prescribing behavior. These incentives encourage overprescription, off-label use, prescribing for conditions or age groups without regulatory approval, and heavy reliance on newer and often more expensive psychotropic medications over older, better understood alternatives, even when the new ones offer little to no proven advantage. Finally, these pressures combined with the regulatory weaknesses and publication biases allowed a culture where pharmaceutical marketing, not patient welfare, drove psychiatric drug prescription practices. Some investigations describe this as a direct systemic corruption. Hayden Huskamp dives into this in his 2008 paper, Prices, Profits, and Innovation, where he stages that many psychiatric drugs, such as Abilify, the antipsychotic that hit the market in 2002, which generated millions to billions of dollars in revenue. These were brought to the market on basis of trials that lacked meaningful clinical benefit and were promoted through biased literature, ghost-written papers, and company-funded research. Also, that the pharmaceutical industry, that was already the most profitable industry in the USA, could maximize their profits. Chapter 8, Worldwide Phenomenon. Many countries replicated the US-style model of aggressively commercializing psychiatric drugs, driven by the enormous profits and the relatively low regulatory barriers created through industry-aligned research and marketing. A 2017 paper about industry-corrupted psychiatric trials notes how this massive issue is rampant across the world. As blockbuster revenues in the US demonstrated how lucrative psychopharmaceuticals could be, nations across Europe, Asia, and Latin America followed suit, integrating similar industry-friendly clinical trial structures, ghost-authored literature pipelines, and guideline-shaping campaigns. The result was a global adoption of a business model in which psychiatric conditions became major commercial markets, and drug approval and promotion practices increasingly mirrored those pioneered in the US, often at the expense of genuine clinical innovation or patient-centered research evidence. Japan is a striking example. Its powerful, conformity-oriented corporate culture provided a fertile ground for pharmaceutical companies to adopt the same tactics, targeting expanding diagnostic categories, increasingly lax analysis of symptoms, promotion of long-term medication use, and funding biased research that reinforced drug-centric narratives. These frankly awesome advertisements are from Pfizer, marketing antidepressants and antipsychotic drugs like Serenase and Norotron to the Japanese populace. They employ similar tactics seen earlier of surrealism, dreaminess, and an artistic flair that captures the eye, and makes the drug all the more attractive for industry use. Personally, these are some of my favorites. I might just be hanging some of them in my room. So why did this occur so easily, and how is it able to cause such widespread damage? Because psychiatric diagnoses are often heavily subjective rather than grounded in objective biomarkers, it became relatively easy for drug companies to influence what counts as a mental disorder, what treatments count as effective, and which medications get approved and promoted. Key decision makers, such as the panelists who revised the reference guide DSM-5, have been shown to receive substantial payments. For example, One received over $14 million US from the pharmaceutical industry, raising serious conflicts of interest concerns that compromise pharmaceutical and psychiatric independence. Industry-sponsored trials have at times been exposed as ghosts written or selectively reported, exaggerating benefits and downplaying harms. As a result, psychiatric drugs were marketed wildly, often as first-line treatments, and creating a global boom in prescriptions and profits, while many patients experienced iatrogenic harm or other side effects. This hidden epidemic persisted until increasing media and public scrutiny prompted regulators and professional bodies to examine and call out these conflicts of interest more openly. Heavy regulations were set in place to prevent this snowballing of overprescription and harm, such as in 1975, the U.S. classified benzodiazepine sedatives like Librium and Valium as Schedule IV controlled substances, reflecting their potential for abuse and independence. Similar strategies like the 1987 National Drug Strategy in Canada also focus on how to approach these issues, such as scheduling more severe restrictions on commonly misused legal substances in attempts to walk back the widespread harm they were causing. The primary reason I got so hooked onto this topic of psychiatric pharmaceutical business is due to just how intrigued I was by seeing these mid-20th century drug ads in class. Since art is one of my biggest passions as well, I tried my hand at making a fictional drug advertisement targeted at businessmen struggling with light to moderate schizophrenic episodes. Honestly, if I'd been alive during this era, this would have been a pretty sweet job, drawing up and designing these surreal psychiatric drug ads. That's all for my video essay on selling Sanity. I want to give special thanks to Dr. Stephen Parnes for inspiring me to undertake this project. I have never had the pleasure of studying in a class that was so clearly aligned with what I was passionate about, and I aspire to one day work in a psychiatric industry, which is ironic as I just spent 30 minutes investigating its very dark and corrupt history. Thanks and have a great day.